Dr. Munjal Thakar, there is a commonly asked question by homeopaths that when a patient comes to you within the first few hours of fever, should we prescribe or should we not prescribe?
Yes, so this is a very common clinical situation that one is faced with. So it depends on the presentation of the patient. Say you have a young child with 104 fever, acute abdominal pain, and the right iliac fossa is tender and is vomiting, then you have a very likely working diagnosis also, and you have to do the case and you have to make a prescription. So that is one thing, that a clinical situation, the clinical diagnosis will very often decide whether you have to make a prescription or no. This is one parameter. The other parameter is fevers like COVID, fevers like typhoid, where the initial 1 day, 2 days, there is hardly any characteristic individualizing symptoms thrown up by the system. In that situation, it would not be right to even make a prescription. So I would refer you to this chapter called The Undeveloped Case in Kent's Minor Writing, compiled by Dr. Gipser. It would be worth reading, where I remember that he waits in a case of diphtheria till the child is almost dead, almost dying, and then he finds a characteristic symptom. I don't exactly remember the case now. And then he takes that symptom and makes the prescription, and the patient is cured in that prescription. So that is going to test your clinical skill, your skill as a homeopath, your skill as a physician also. So very often in my clinic I will wait till the characteristics come out in the case. But if the pathology also develops in waiting, how long do you wait? If the pathology is running faster than your ability to develop the characteristic, then you pay respect to it and make a prescription considering that case as a paucity of symptom case. So there is no one standard answer. It depends on your acumen, it depends on the patient's condition, depends on what is your diagnosis. If not an established diagnosis, what is your working diagnosis? At least a working diagnosis has to be on your mind. That will also help you to create a totality and choose what is characteristic or what is not characteristic in the case. That is very important.